So, hi, and welcome to Raw Belly and Conversations. This is the ProDog podcast where we help you take a more natural approach to your dog's health and happiness. So, today's episode, we'll be discussing a very important aspect of your dog's overall well-being, i.e., their digestion. So, I'm your host, Alison Frost, Canine nutritionist and part of the ProDog team. Today, we have a very special guest joining us, Dr. Nick Thompson. Welcome, Nick, a renowned holistic.
Alison, great to
Hi.
see you. Thanks a lot. Thank you. Appreciate it.
No, you're welcome. Dr. Nick Thompson is a renowned holistic veterinarian, aka the Holistic Vet. You can always check him out online. Got lots of podcasts and videos which are really interesting, and has very extensive experience in natural and integrative approaches to pet health. So thank you, Nick, for taking your time to join us today.
No, pleasure. Can't wait to get cracking.
Yeah, brilliant. So, from understanding the signs that indicate your dog's digestion needs support to exploring why gut health is so important, Dr. Nick Thompson will provide some invaluable insights and practical advice. So, without further ado, let's dive in and welcome to the show. So, Nick, we're talking about digestive issues today. So, what would you say are some of the common signs that indicate a dog's digestion might need some extra support?
Okay, let's go for the most obvious one. So if we're starting, I love to be systematic about this. If we start at the front and move to the back, so if the dog has got foul breath, now there's many causes of foul breath, but one of those can be upper digestive tract issues. So if there's a change of breath, even if everything else is exactly the same, I think you have to be a little suspicious of the food. Okay, so moving down, if you've got any type of regurgitation or vomiting, sometimes morning vomiting, bilious vomiting, these kind of things, that can indicate that the stomach is not happy. We've got maybe some gastritis there. Moving down a little bit further, if we've got signs of gas and squeaking and bubbly tummy, it's kind of obvious. Everybody gets it every now and again. When I say everybody, I mean dogs and humans, because let's face it, dogs and humans are very similar.
Yeah.
But so noises from the gut that you're not used to, I think is a real indicator. Recurrent moving backwards again, recurrent anal gland problems, it can be an issue. And then if we're looking at the stool, so if there's a change in stool quality, and that can either be the stool getting more loose, or you could see perhaps mucus or blood or pain on passing that stool. That can be signs of colitis. Pain, blood, and mucus. It's not because your dog has swallowed cling film, or whatever it might be. It's because your colon is unhappy. So those would be some of the most obvious digestive changes that we would be looking for.
Yeah, and sickness, sickness a lot as well, isn't it? When
Vomiting, regurg, vomiting, for sure.
Exactly. So can you explain why the digestive system is so important for a dog's overall health in general, and how it sort of can impact other areas of their well-being if it's just not working optimally how it should be?
That's a really good question, and it's okay. Let's do a thought experiment. You've got a car, and you either don't put petrol in it to save money, or you put water in it to save money, or that's what you can get hold of, or what have you. What happens? Yeah, it's a rhetorical question. The car will either not function or will be broken by that thing. And I think that's a very good analogy. Food are the building blocks for every element of metabolism throughout the body.
Yeah.
And if the food that's going in is less than optimal quality, and from where I'm sitting, many vets would say that's really good quality kibble. I completely disagree with that position, and Cairns is the same. I disagree that is the optimal way to feed a dog. I think the optimal way to feed a dog is primarily raw.
Mm-hmm.
There are some dogs who, and we're talking 1%, 2% of dogs, they don't do so well on raw, and so we look at perhaps a fresh, very lightly cooked option. But for me, the quality of the fuel going into the system will determine the energy, the quality of the metabolism, how healthy and bright and chirpy and energetic that dog might be, and obviously it helps feed the microbiome. So that will impact immunity. And if your immunity is less than perfect, you're going to run into all sorts of problems. So that's a very long answer for a very short, very simple answer, which is food is the building blocks of life, and we've got to get that right for health and longevity.
Well, yeah, exactly. And, we are, as we say all the time, humans are the only species on the planet that actually process, change, denature, and cook their food, you know?
And look at the result. Look at the result. Yeah, over the last 30 years, especially, but you could drag that to 50 years. We've just been getting more and more and more unhealthy.
Yeah.
In humans, heart disease is rising, obesity is rising.
Diabetes.
Diabetes, metabolic disease, all these things. And there is a similar with diabetes and obesity and overweight dogs, reduced longevity, autoimmune disease. We're seeing something similar. So if I can't think of any nutritionists worth their salt who would say, I know it's a really good idea if you eat more ultra processed food. Yeah, I think that we can all agree that good quality food really is the seat of really good health.
Yeah, and the more natural it is, the more bioavailable it is for the dog, the more easy it is to digest. It comes
Totally.
with natural digestive enzymes, so that means that they're absorbing and assimilating the nutrients much more effectively, which affects every cell in the body, which
Yeah,
is,
yeah,
like you say.
yeah, totally. You've got a system there. You've got the digestive system, which has evolved over 45 million years to eat raw food, and that's what it's really good at. So if you feed it ultra processed food, I think you can expect that you're going to see problems because you're giving an inappropriate uh, nutrition source, food source to
Yeah.
that system, and it's just going to get confused. And so you get the IBDs, you're going to get the pancreatitis problems, you can get skin problems because of the leaky gut issues that
Yeah.
can influence.
Yeah, I mean, I
So
think the next question that we've got that rolls on from that is why dog owners pay close attention to the dog's gut health. And I don't think necessarily people understand that if the dog's got allergies, symptoms, itchy skin, mucky ears, anal gland issues, that actually it's because the digestive system is not working optimally like it should do.
totally. People don't sometimes don't make that association. For example, Labradors with mucky ears, they can go back and forth to the vet, and the vet will very effectively clean those ears. But if it comes back and it comes back, there must be something else going on. And I would approach those guys, yeah, let's clean up the ears and make them as comfortable as possible. But if the root of the problem is they have a sensitivity to something in the diet, you're never going to get a long-term resolution of that problem. So yeah, again, let food be thy medicine. It's so important, and this is not new, Alison, as if you talk to your grandmother, she'd say, well, of course, you feed rubbish, you'll get rubbish.
Yeah, exactly.
We've known this since man first walked the planet 12 or more thousand years ago. We know that food is massively important, and even more so with the modern dog, the modern human, because there's stress, there's toxins in the environment, and all these things. So food always has been the cornerstone of great health, and even more so now, and especially for our dogs, that's for sure.
Yeah, definitely, definitely. And the good thing is with the raw food diets now, we've got so many great DEFRA approved manufacturing food. That it's a lot easier than it used to be in the day when I first started raw feeding.
It's a lot easier. When I first started, there was only one major supplier, right? And now there's what, 300 DEFRA
Yeah,
approved. Yeah. So the world is completely different. And I'm so delighted at that.
I
I
know.
never thought I'd see the day where every town in the country, as far as I can see, has got a raw store, and these are usually independently run. So please do support them; they're fantastic places,
Yeah,
and they're usually run by people who have seen massive transformation with their dog, and they just think, "Oh my God, this is so amazing! I want to tell everybody in this town about this thing that I've discovered."
yeah,
It's just it's a fairy story. It really is. It's so exciting. I'm so happy to have seen it. That transition from, oh, you feed raw food. What's that? Dogs can eat raw food. That's
uh-huh.
what we used to. And I used to go to shows, and I would actually get insults. From dog shows. Yeah, from I'm not going to say which group, but I would actually get insults. And nowadays, I get interest.
Yeah,
Yeah. And there's zero negative comeback. So the world has moved on. I think we've still got work to do. And it's really important that we don't let up. And that's why, conversations like this are really, really important, because we can just say to people, it's simple, it's economic, it's easy. And boy, oh boy, it's so much a foundation of health.
yeah, definitely, 100%. So what tips and practices? I know we've discussed raw feeding, obviously. Would you
Yeah.
recommend for maintaining good digestive health in dogs? So we obviously know food is the pinnacle, but
Uh-huh.
are there other specific diet supplements or routines that may be beneficial as well?
Yeah. I'd say raw food feeding would be the number one thing to do. If your dog has got problems with even with certain raw foods, then I think a food trial where you try 2 weeks on one single protein,
Yeah,
and you guys do a range of single proteins. And I know that, and I send a lot of people to you, Alison. I just say, listen, have a chat to ProDog, and in particular, talk to Alison. Yeah, you must get sick of everybody coming. So, oh, Nick sent me. Nick sent me.
oh, I like it. I like
But
it.
but
Yeah,
but I know that you'll look after them, okay? And so, I think a food trial is really, really wonderful. Back in the old days, even 5 years ago, I was saying to people, use raw vegetable materials. Nowadays, I'm moving more towards lightly steamed or also fermented. Yeah,
yeah,
fermented vegetables are
yeah.
are becoming really, uh, really, quite fashionable. Fashion is the wrong way to describe it, because actually I think they're going to be with us forever because they're
Well,
so
the good
so
thing about
beneficial.
fermented vegetables as well is you can get
Mm,
them quite easily now. I mean, obviously, we always try and make sure that checking the label in your supermarket that they're not pasteurized, that they're still raw, and they still got all the beneficial bacteria in.
yeah, yeah,
But you can even get it on Amazon delivered now. Sauerkraut.
awesome.
It's really easy to
Yeah,
make, but if you
yeah.
like me, lazy, can't be bothered getting your hands dirty. It is so easy to buy it.
That's really funny. Yeah, well, I'm as bad. Ellie does all the prep for the dogs, but and I lean over her shoulder and go, I wouldn't be doing that if I were you. It goes down really well, as you can imagine.
Yeah, I know. I know.
Or whenever I take her, I'll feed them once a week maybe, and I really enjoy it. Yeah, because I'll just say, right, I'm gonna have a bit of this, and we'll have a bit of this, and a bit of this, and it's fun. It's
Yeah.
really great. I love it.
Yeah, I mean, I think the good thing about the fermented foods is they'll all be very slightly different. So there'll be different
Hmm.
strains in
Hmm.
there, and obviously, like you say, you're getting more nutrients out of fermented foods anyway. Even I think sauerkraut is probably one of the best forms of vitamin C. That
It
sort of
is.
thing.
Yeah, no, it's fantastic, isn't it? Yeah,
Yeah.
it's
So
brilliant. Okay, so other thoughts. Bone broth. I love bone broth.
yeah,
You guys do bone broth.
yeah, we do. Yeah, we do some
Yeah,
bone broths.
yeah. So that's
Bone
really,
broth.
really useful. Colostrum is potentially really, really useful. I love the whole NHS thing. That means nuts, herbs, and seeds. And you've got some herb and supplement blends which are really, really nice. So and I'm not advertising just for the sake of it. I'm just saying these are great products. Okay,
Yeah.
so definitely worth people having a look at those.
Yeah, brilliant. Okay, thanks. So if someone's dog has got a dog that's got poor gut health and a lot of the symptoms that we've just been discussing,
Yeah, yeah.
um, so what steps would you say an owner needs to try and address to try and improve this?
Sure. It's going to be slight repetition of what we've said earlier, but
Yeah,
that
yeah,
sometimes a bit of repetition is a good thing. So, dog for some reason has developed a bit of diarrhea, all right, and they get a little bit better, a little bit worse, and a little bit better, and a little bit worse. They're reasonably bright in themselves, yeah, because if they're sick, you need to get to the vets immediately.
yeah, definitely.
But so that they're reasonably well in themselves. It's just the tummy is not as reliable as it used to. So I think the first thing to do is just make sure that there's no infection there. Talk to the vets. Look for Salmonella, E. coli, Giardia, things like this, to make sure there's no fundamental thing. While you're talking to the vet, you can think about, is the dog fundamentally well? So you may go for a blood test, liver, kidney function, pancreas function, these kind of things. I think that's a really good place to start. If vet turns around and said, nope, everything's really clean and everything's looking really good, then you're pretty much in food territory. And this is where I would do a food trial.
Yeah,
If people know how to do that, that's great. If not, they can talk to you or they can talk to me and doing a
yeah,
food trial. But basically, there's two key elements. I would do single protein, even if the dog has had it before here and there. It doesn't matter. You can just do that 2 weeks. If it's up to me, I try usually 4 different proteins. So you do protein A and then protein B and then protein C and protein D. Okay,
yeah,
and you may find that when the dog is on protein B, for example, they get runny poos. But when they're on A, C, and D, they're good to go. So that just shows that they have drifted into some kind of sensitivity, and they're just saying, I can't take chicken, or I can't take lamb, or whatever it might be. The only way to do it. The key with doing food trials is you've got to make sure that the treats are the same single protein as the headline protein.
yeah,
Okay, that's it. Apart from that, it is dead easy to do trials. It's a bit of a pain. You've got to get it in. You've got to be a little bit careful. And when Auntie Maud comes to visit, you cannot let her give the dog digestive biscuit or whatever it might be, as she normally does. Okay, so you've got to be a little bit strict. But apart from that, it's pretty easy and can be transformational. So
yeah,
definitely,
definitely.
that's a really, really a good thing to do in order to find out, because you can't fix the car unless you open the bonnet. Yeah, you can't unless you actually have a look at the engine. And by doing the food trials, if you like, it's a bit like having a look at what the gut function, how the gut is relating to those proteins that may or may not be a bit sensitizing. In addition to that, you can think about bone broths are really very healing for the gut.
Yeah,
Um, Pre and probiotics can be very healing for the gut as well. But I think that if you're doing anything more than a food trial, and you may want your hand held to do a food trial, talk to you, talk to me, talk
yeah,
to any raw feeding vet, and they'll be able to take you through that process. It's just a question of just doing it systematically, changing just as few things as possible, so that you can really identify what resonates with the dog's gut and what
yeah, and
doesn't.
and
Yeah.
keeping a diary as well. I always say just keep little diaries, just
Mm,
little logs
mm,
so that you can do it. And also, as I say, we've had a lot of customers that have gone through loads of different types of forms of food, whether it's different brands of
yeah.
kibble, whether it's wet
Yeah.
food, and the dogs have never really maintained a decent weight. And then all of a sudden
Mm,
they'll go onto a raw diet, and it's like, wow, why did I wait so long to try this? And it
totally.
always makes me heart flutter that, because I just think great, and they're the
Yeah.
sort of people that are then shouting from the absolute rooftops.
Yeah.
But for a holistic approach as well, and
Mhm.
especially with dogs that get intermittent loose stools, diarrhea, and they've had the Giardia test, they've had stool counts done and everything else.
Mm,
The one thing, I always sort of say to them is, just check when if you're giving chemical flea and wormers, especially wormers, because I don't think
Mm,
people always realise how much that affects the digestive system, the gut, and,
mm, mm.
loose stools and nausea that goes with it.
Yeah, yeah, totally. Because we have got, back in the old days, fleas and tick products were just on the outside of the dog, and there is still, lots of drop-ons and sprays and all those kind of things. But nowadays there are tablets, yeah, Brevecto, NexGard, and everything that goes in your mouth will affect your microbiome.
Yeah,
And if that thing that's going in your mouth is actually designed to kill stuff, then it's going to have, potentially a negative effect on the immune system. So I would be really careful with those kind of products. I'm not saying don't use NexGard, for example. I don't like Brevecto, but NexGard, I think, is possibly the least worst.
right.
I don't like using these topical, the drop-ons, the Advocate, Advantage, those kind of things, because as soon as the dog, as soon as you wash the dog, or even if the dog goes out in the rain, they're contaminating. They're contaminating, the environment in a really, really big way. They come home, you dry them, and you get covered in this stuff. Only a tiny layer, but it is potentially toxic. And if you're doing that repeatedly, you're just marinating in these toxic chemicals. And
Yeah,
so we need to be really careful, avoid wherever possible those kind of things. You were saying about a diary, food diary. I think it's a brilliant idea. I often get people to do a spreadsheet.
yeah,
Now, there's two types of people in the world. There's those who really love spreadsheets and those who really hate spreadsheets. But actually, it's just like primary school. It's just, can you remember at school you had your book had maths books had squares, a grid on them. That's a spreadsheet essentially. So it doesn't need to be fancy. It doesn't need to be all singing and dancing, but a very, very easy way to just keep on top of things.
yeah. And I just say log any treats, like you say, if you're doing a food trial anyway. It's the best practice is to make sure that you stick to that single protein. So if you're trying
Yeah.
venison, only get venison treats, 100%, etc.
Yeah. Yeah,
And
totally.
things happen. We all know that raiding the bins, eating the cat food, things like that will happen. But if we log it and we know about it, we can always
Mm.
refer back. And sometimes things jump out at you. Like you say, people don't always realise that giving these monthly or 3 monthly, parasite control treatments actually are affecting the digestive system. And so
Yeah,
you actually look at it when they've written it down of everything that they've done.
yeah,
So
totally. And if the dog normalizes after that, doing the trials, changing the diet, whatever it might be, they don't need a spreadsheet. They don't need a diary. Yeah, the normal dog. I've got 3 sight hounds downstairs, and they haven't got food diaries. Okay, the normal dog
oh,
needs no diary unless you want to, in which case go for it.
yeah. Yeah, or either
Yeah,
just post everything on social media of all your great
yeah, you can do
meals, and
that
then
as
you
well.
can always
Yeah,
check
yeah,
that. That's fine.
yeah.
So, I mean, I know we've gone through so much, so we'll just recap. So, preventative
Mm.
measures for long-term health, which obviously from the digestive system is a species-appropriate diet in the main, a raw diet, with a good
Ideally
balance.
raw, but
Yeah,
yeah, yeah,
and some, like we know, some dogs do better on slightly cooked food or cooked food for whatever reason.
yeah,
Um, but yeah, and a good variety of different proteins and meats and offal and eggs and all the other great stuff that goes with it.
yeah,
Um,
yeah, totally. And fish, even if you get tinned sardines, tinned mackerel, things like that, there's a lot of value there, massive value there. I always use, in some form or other, NHS nuts, herbs, and seeds,
yeah,
ground up, put into the foods. But I also I'll put an omega-3 source, either fish oil, krill oil, these kind of things. I think they're really really valuable because we live in a very inflammatory world.
yeah, we do. And that's when you say probiotics, fermented food is really good to add
Mm,
in, bone broths again, which are really healing and hydrating. And
mm,
prebiotics, some antioxidants and prebiotics which you'll get in some supplements, some vegetables, some nuts and
mm,
seeds, as we say,
mm, mm.
just to making sure that all of those great bacteria are being fed so they can thrive and do their job that they're supposed to do.
Yeah, totally.
And obviously trying to reduce as much chemicals and as you can. I mean,
Yeah, it's not always what you put into the system, it's what you take out of the system. I think
yeah,
that's really good. So putting great food and into the system and taking out anything that you can without compromising the welfare of the dog, anything that you can take out, any chemical intervention that you can take out, that's really, really good.
yeah, definitely, and antibiotics as well, but they are needed at times,
If
and
if they're needed, but to be avoided where possible. Yeah, for sure.
yeah, yeah. So no, so that's great. So I think we've covered everything on digestive health and how to optimize your dog's well-being by fueling their digestive tract and ensuring that they are getting everything that they need in the most
Mm.
viable, easiest to digest form that they possibly can. So so thank you, Nick, for sharing your expertise with us today. Um,
Absolutely fine. I just want to reiterate, it is pretty simple and it's a lot of fun. Okay, so if anybody's watching this and go, "Oh, I'm a bit scared," don't be scared. Well, you will be scared because everybody, when they go on Raw, absolutely everybody I've spoken to for the last 30 years says, "Yeah, I was terrified for the first few weeks,"
I know.
and then they come through and they, like you say, they say, "Well, why didn't I do this 20 years ago?" You know. So there's it's all to play for. There's so much good that you can do for your dog. So and it's fun. It's enjoyable. It's great.
Yeah, it is enjoyable. It's enjoyable to watch them actually enjoy the food
Mm,
and the different types of variety in there. And
mm,
obviously, a healthy gut leads to a much happier, generally healthier life for your dogs, which is what we all want. So that's
totally.
the main message. So, well, thank you very much. That's great. And if you want to sort of follow by hitting the subscribe button below for more insights and tips on canine wellness, please do. And up until next time, take care of yourself and your dogs and happy digestion. So thanks, Nick.
Thanks,
Okay,
Alison. Appreciate it.
bye.